Khan, and I work at HTA. I work at HTA Health Academy as a product manager, which means that all of the programs, which are primarily our products, are designed by me and my team. I have a team of subject matter experts who work for me to develop all those products. And I'm going to talk about all of those products, which are, again, the programs that we offer at HTA in detail in this webinar today. It's going to be a lot of products that we are going to cover. So hang in there to get to know about all of this information, and let me know when you guys can see the screen, and then I will start over. All right, I think you guys should be able to see the screen now. So Health Tech Academy, HTA, and this is Allied Healthcare Bootcamp webinar. We are going to talk about all of the boot camps that we offer, and I will cover all the details in terms of the offerings that we have for each of those products, each of those programs, and I'll also be able to answer any of the questions that you guys may have. And before we begin, I just want to make sure that you guys, familiarize yourselves with the Zoom webinar. You guys will be able to see a question answers section where I would like you guys to answer any questions that you have. Sure that you remember all the questions that you have. I would suggest that you wait for the last 10 to 15 minutes of the session, which will be dedicated to the question answer session. But if you feel that you will forget about the question and you don't know how to, write it somewhere else, just send the question straight away and I will try to answer it whenever I take a small break, or I will answer those questions at the end, or one of my team members will answer the question in the question answer section by replying you via text. So as I think, let's start with the introductions for HTA. Health Tech Academy is an online training provider based in Austin, Texas. That's where our headquarters are, but our team is based all around the US and all around the globe in some cases. We have more than 25 years of experience in the edtech space, and we have more than 15 years of experience in the healthcare space. We currently have more than 30 coaches. Then this number is a bit outdated. We have more than 30 coaches, which are industry experts and professionals who come from the healthcare industry, and they coach you one-on-one as you move forward in your learning journey. And we currently have more than 1,000 students enrolled in one of our programs. Again, this information is outdated from last month, and we had more than 200 students joining in the last few weeks. So this number has been updated, but I couldn't really get a chance to update this. I would want you guys to stick around till the end of the webinar, where I will be sharing some of the tuition deals and discounts. So I think you guys would love to hear about that. So let's go over the agenda, table of contents. So, okay, I think Ron pointed out that we should call them boot camps, not products. Yeah, that's true. For me, they're products as the product manager, but of course, these are boot camps, these are programs. When I say product, when I say boot camp, when I say program, they all mean the same thing. So let's try to use the word program or boot camps from now onwards. Thanks for pointing that out, Ron. So we will start off by talking a little bit about HTA. I've given a short introduction for HTA, but I will dig it deeper, tell more about our vision and our mission and our partners. Then I'm going to talk about the future of allied healthcare, which kinds of sets the context why this industry is relevant and how you can step into this industry and how you can stay relevant to the future of allied healthcare. Then we're going to talk about our boot camps. I think we're going to talk about 13 or 14 boot camps, which is going to be pretty long. I'm going to speak a lot. And you guys have to bear me for that. Then I'm going to talk about the admissions process. Then I will talk about the financing options, career services that we have here at HTA. We'll be able to hear from our students through some testimonials. And then we will end the session with the question and answers and some discounts that we will announce at the end of the session. So about HTA, so we are a leader in flexible and accessible online training for more than 20 years. We build programs around the growing areas of allied healthcare. And if you are someone who wants to start their career in allied healthcare and you haven't really had any experience in this industry, you are at the right place. We have a number of programs that can help you start your career in healthcare. And all of our programs are self-paced, 100% online, which means you can start the program while you're doing a job, or you're maybe completing your bachelor's, or maybe you're switching your career from one field to another, and anything like that. You can enroll into our program if you can spend 10 to 15 hours a week to complete these programs. Our vision is to transform and innovate the way healthcare professionals are educated, hired, and retained. And our mission is to solve healthcare staffing challenges by partnering with universities, employers, and educating citizens for emerging and diverse roles through apprenticeship learning pathways and career coaching. Um, how our bootcamps work? So our boot camps are designed while working with industry experts, and that's what my role is here at HTA, where I work with industry experts, with universities, employers, healthcare professionals to create the industry-aligned boot camps, making sure that all of our programs are aligned with the requirements of the certifying bodies to help you guys get certified in that particular field or specialization. So our boot camps have different courses, modules, and all of the instructional model is designed to fit around your schedule. And that is basically our focus, where we want to make sure that our programs are on demand, self-paced, and one-on-one coaching sessions are offered. These are three main aspects of our programs. And we have a dedicated team of student support, career services, which is going to be there around the clock to help you in every possible way and wherever you struggle. So we have quite a lot of partners, but UTA, Hofstra, NCCT, NHA are a few that we have mentioned here. But if you go on our website, you can see a lot more. And we have a lot of partners which are offering externship sites for the students to complete their externship requirements, and some of the partners which are helping our students to find jobs. So in terms of the program flexibility, which I've kind of covered already, so our programs are designed for a range of experience levels, including beginners who may have limited or no healthcare backgrounds at all. You don't need to relocate for our programs. You can join our programs from anywhere. Our training programs are 100% online, but remember that if you are enrolling for a program that requires you to complete certain clinical hours, you have to do that in person, of course. You can't do clinical hours online. And that takes me to the next part of this webinar, and that is future of allied healthcare. Now, just like all of the fields in the world, any field you can think of, there are a few changes that are happening with the modern technology being in place, modern technology being integrated into those fields. So there are a lot of things that are changing. Healthcare, in my opinion, is changing in a lot faster pace as compared to rest of the industries. And allied healthcare roles are in a very high demand, and they have been in high demand in the past as well. But the demand is only going to increase. And the integration of the technology is something that is also increasing, and that means that there's an increase in terms of the demand for roles which are specialized in technology in one way or another. And that also means that you being able to complete an online program will give you some of the learnings which you probably would not realize unless you get into the professional world, and you will realize that because you did an online program, you were able to learn certain tools which were not directly relevant to your skill that you were learning, but they will be able to help you become well-rounded professionals. So the best way to catch the future light healthcare trends is to be working in the industry, or to strive to start working in the industry. Gain some industry experience at an entry-level position that you can get after completing one of our programs and passing the certification exam. So that's what you should do if you want to be relevant in the future in the allied healthcare space. Now, If we talk about some of the trends which we see currently in the surgical technology, I'm sure you guys have heard about robotic assisted surgery, where robots are performing the surgery. Now, although the robots can perform the surgeries, but somebody else has to kind of uh, supervise those robots, and they have to train them. Somebody is developing those robots, somebody is testing those robots. There are a lot of things that is happening. So although people can think that their roles would be replaced by robots or by technology, but in reality that technology is also creating a lot more job opportunities, because you will be able to assist a lot more patients in lesser time. But those jobs are going to remain there. They're going to change as the technology is integrated into the sector, but you're not going to lose your job, hopefully. Same goes with pharmacy technology. There are a lot of medication dispensing automation softwares that are in place these days, and you are going to get trained on those softwares in order to make sure that you know how to follow the whole process. So everything can become automated, but at the end of the day, there has to be somebody who is running those softwares, or who is supervising the work that is being done by the software, because there can be a glitch that software might not catch, but you as human can catch that. Because at the end of the day, AI is artificial intelligence. You have that human intelligence, which can probably beat AI in a lot of ways, not in terms of speed, but in terms of the logic. Sometimes you can absolutely beat it. Same goes with medical assistance. Same goes with sterile processing trends. All of these things in future are going to be there. There's nothing to be scared of. The only thing that you should think of is how to remain relevant in the future. And the way you can stay relevant is, start your career, take the first step, enroll in one of our courses, one of our boot camps, and that would be the first step to stay relevant in future. And that takes me uh, to the major part of our webinar today. So I'm going to talk about all of these programs in detail. A lot of the information is going to be repetitive, so I'm not going to repeat all of those information. I'm just going to say that it's the same as the previous program, but I'm going to cover most of the information and make sure that you guys understand anything and everything about these programs. So surgical technologies program is where we have Tech in Surgery Certification, TSC, by NCCT. Now, this is a nationally recognized certification that you can complete, and it is accepted in most of the states around the US, except the states that are mentioned in the last column. Now, this is something which is very, very crucial for you guys to understand. For all of our programs, there might be a few states where the program is not available. When we say that the program is not available, it doesn't mean that you cannot complete the program in that state, or you cannot get certified. You can get certified, but you cannot probably work in that state. Now, why do I say the word probably and not say certainly? Because there are always some exceptions in terms of some institutes which can probably have you, even if you are based in one of these states, but you will have to get soft yes from those institutes or those clinics or hospitals before you enroll into the program, because we cannot guarantee that you will be able to find jobs after doing the certifications in these particular states. For all other states, you should be able to find jobs. The duration of our program is 16 weeks. It's all online. Remember that this duration, 16 weeks, is an estimate. If you are completing all of the learnings that we are asking you to do, all of your quizzes, reading your chapters from the ebook, and anything and everything that we want you to do, if you are doing all those things, then it would take 16 weeks, and we estimate it to be 12 to 15 hours a week. If you spend a lot more time, you can complete it sooner. If you are very, very productive and very proactive and very efficient, you can probably complete it sooner, even if you're spending 10 hours or 8 hours a week. I don't know. It can be different for everybody, but this is an estimate for an average human being. The tuition is $3,450 upfront, and monthly pay starts from $266. So the full fee is $3,450, and this includes everything in terms of ebooks, coaching sessions, certification exam preparation course, which is officially available through NCCT is it's called self-assessment. So you can complete that self-assessment to assess yourself. Where do you stand in terms of your learning? Um, all of those things, and the exam voucher. One exam voucher is included in that price. In terms of your eligibility, you need to have a high school diploma or equivalent qualification, and an internet connection. And you should be able to browse the internet. You should know how to use Google or Gmail or any other mailing softwares or any other search engines, and you should be able to use the computer or navigate the computer, because if you don't know how to do that, it will be very difficult for you to navigate the online platform that we have. Although our platform is very, very simple and straightforward, but people who do not, who are not tech savvy, I mean, tech savvy is a heavy loaded term. Anybody who does not know how to use computer for day-to-day use, it would be difficult for them. And another thing is, for the surgical technology program, although that is not a requirement, we do recommend the students to have a little bit of healthcare experience, which can help them get jobs easily, because search tech roles are kind of advanced roles, although you don't need any kind of background. That's not specified by NCCT, which is a certifying body, but we have seen a trend that anyone who has some experience in the healthcare space, whether as a worker, or as a, I mean, you might have a qualification in healthcare, in any subjects related to healthcare, that can be an advantage for you, and that can help you find externships easily. You'll be able to complete your clinical hours easily, and you will also be able to find jobs easily, as compared to those who does not have any experience at all. So we do recommend that if you do not have any experience in healthcare sector, you don't have experience dealing with a patient one-on-one, in any of your previous roles, we do recommend you to get enrolled in any other programs like medical assistant or sterile processing technician or EKG technician or phlebotomy technician, where you can gain some experience, and that will be a great stepping stone in terms of becoming a search tech in future. Now, when you enroll in one of those programs that I just mentioned, remember that finding the jobs or finding the externships for those roles is a lot easier than search tech, because search tech is a very high in demand role, but it also is a very highly saturated market, where there are a lot of search techs waiting for their roles. So it is difficult to find the externships or jobs, and the requirements are also a bit more hard. I mean, not harsh. They are a bit difficult to be completed, and that's the reason why do we do suggest students to get some healthcare experience before enrolling into search tech programs, because that kinds of gives you an edge when you will apply for the search tech roles. Um, we only have four programs where, apart from our program and passing the certification exam, there is a clinical experience requirement, which is there for surge tech. There is a requirement of completing 125 scrubs, which means 125 surgical cases, which are in different specializations. You have to complete that in order to become a surge tech. If you don't complete that, you cannot be certified. Now, it is not a requirement to complete those clinical hours before sitting for the exam, but it is highly recommended that you complete your clinical hours first and then sit for the exam, because we have seen that students who do not complete their clinical hours before sitting for the exam struggle with the exam a lot, because at the end of the day, when you are in the field and you are doing things practically, that helps you learn a lot of things that you probably missed out or you have forgotten while learning it theoretically. So just keep that in mind, that you will have to complete clinical hours, and you should be completing your clinical hours and clinical requirements before you sit for the certification exam. That is recommended. If you really want to appear for the certification exam before completing the clinical hours, we can also do that for you. But this is again something that we recommend. In terms of the offerings, it's a self-paced program. One thing that I've mentioned and I haven't really talked about it a lot is one-on-one coaching. So all of our programs come with one-on-one coaching, where you are required to schedule 5 mandatory one-on-one live coaching sessions with industry experts. Remember, at the start of the session, I said we have more than We have more than 30 coaches who are industry experts from the same field. So we'll have a surgical technologist or a surgical technology professor who will coach you one-on-one, answer any queries that you may have, and help you with anything and everything during those 5 coaching sessions. We also have a career services team, so they will offer career support. We have an ebook that we will provide you access to. We have skills videos, and the exam voucher is also included in this price. At the end of all of our programs, there's also a career preparation course, which will help you learn some basic professional skills that will help you in any field that you go into in future. It helps you become a better professional. You can download the syllabus and the content outline from our website. So you can go to the website, fill that small form. It's like 4 or 5 fields that you have to fill, and then you will be able to download the syllabus for it. And that takes me to my next program, which is medical assistant program. The certification that we offer is certified clinical medical assistant by National Health Career Association, NHA. The duration of the program is same. Certification is CCMA. The tuition is 3,450, so it's same as Surge Tech. Eligibility is same, no requirements, no additional requirements that I explained. For Surge Tech, you can enroll without any kind of experience, and you will hopefully not have any issues in terms of finding the jobs. Now, unlike Surge Tech, medical assistant program does not require you to complete any clinical hours. You can complete the online learning, and you can find your jobs after you pass the certification exam. The offerings are the same: one-on-one coaching, certification exam preparation, which is an official study guide from NHA, career support, ebooks, skills videos, exam voucher. It includes everything. The restricted states are only two for medical assistants. So if you are from one of these states, uh, either don't enroll in this program because we cannot guarantee that you will be able to find a role in these states, or you should reach out to some of the hospitals and clinics around you and ask them if they'll be happy to have you with this credential. Because if they say yes, you can probably find more as well. But again, it will still be a risk, and we do not recommend you to take that risk. You can download the syllabus again from the website. Rest of the information is the same. Patient care technician, that is certified patient care technician, CPCT by National Health Career Association, NHA. Almost all of the things that I just shared about medical assistant are true for patient care technician as well, except that North Dakota is a restricted state, sorry, for patient care technician role. And if you are from North Dakota, you will not be able to enroll into this program unless you have an offer, a soft offer or a soft yes from one of the hospitals or clinics. Again, you can download the syllabus from the website. The price is the same for a patient care technician role. Patient care technician role and medical assistant roles are pretty similar to each other, and they have a very, very slight difference. In the role itself, the basics are pretty much the same. The kind of content that you learn is also similar. All right, pharmacy technician. Now, pharmacy technician program is the same duration, same price, same eligibility as medical assistant, and same offerings as well. The restricted states are a little more, as you guys can read here. Now, one very interesting thing about our pharmacy technician program is that we used to have certified pharmacy technician by National Health Career Association, NHA, but we recently launched, and I announced this in our last webinar, we recently announced Pharmacy Technician Professional Program, which is by PTCB. And now you can see that our current Pharmacy Technician Program by NHA has these many restricted states. So if you are from one of these states, you can enroll in our PTCB program because they have no restricted states whatsoever. And PTCB certification is widely accepted across the industry for people who are certified pharmacy technicians. You can enroll in any of these programs. The requirements are the same. NHA program is a bit easier, a little easier, although the content is pretty similar. And the PTCB certification is a bit difficult. But if you have to choose between both of these, PTCB can probably get you more opportunities because it is widely more accepted. You can download the syllabus for both of these programs from our website. You will see two different product pages, program pages or bootcamp pages on our website for these programs, and you'll be able to download the syllabus for both of them. And that takes me to my next program, which is Dental Assistant Program. It's a registered dental assistant program, RDA, and this certification is available through AMT. The price duration is the same as the last programs that I covered. Eligibility is the same as well. The offerings are the same, and the restricted states are only 6 states where this program is not available. You can download the syllabus for this program from our website as well. So, except SurgeTech, till now, there are no programs which have any kind of clinical components or clinical requirements. But now we have the second program with the clinical requirements. That is Sterile Processing Technician, CRCST by HSPA. Now, remember how I was saying that in case you do not have any kind of healthcare background and you still want to get into surge tech as a career, you should start somewhere else, maybe medical assistant, maybe CNA or any other roles. Sterile processing technician is very, very close to surgical technologist. And I'm sure you guys can understand surgical technologist is a person who hands different surgical instruments to the surgeons and they assist in surgeries. Whereas sterile processing technicians make sure that the sterilization process is followed properly before the surgery. I don't know, maybe during the surgery and after the surgery as well. So they are one step before anything goes to the surgical technologists. So because they work in that same room, same operation theater, same environment, same clinic, same hospital, same room, they get a lot of things. They learn a lot of things, and because of that, they are able to become surgical technologists after passing the certification exam a lot easier because they get that experience. So the duration of this program is the same, the pricing is the same, but the barrier of entry is lower as compared to Surge Tech. So you can become a sterile processing technician first, and there are no restricted states for this program. And then you can become a surge tech after gaining some experience, maybe 6 months, 1 year, and then you can become a surge tech. Now, a lot of students can argue that if the surgical technologist program does not have any eligibility requirements which restrict us from enrolling into the program, why are you suggesting sterile processing technician? Now, the reason why we do suggest sterile processing technician is because if you do surgical technology without having any kind of healthcare background, it will take you a lot longer to find the externship site. It will take you a lot longer to complete those cases. It will take you a lot longer to get a job. And you don't want to waste any time. So for that reason, you do sterile processing technician, become certified, complete your clinical hours. You have to do clinical hours for sterile processing technician as well. Complete those hours. Finding those externships for sterile processing technician is far easier than surgical technology. So complete those hours, get certified, pass the exam, and start working as a sterile processing technician somewhere. And even if you don't find opportunities to work as a sterile processing technician, at least you have completed those clinical hours, which have given you some of the experience in the clinic, in the hospital, very closely working with the patients. Then you can think about doing surgical technology certification, and it will really, really be. I'm comparing you with somebody who does not have any experience. If you do follow this path and then you move towards surgical technologist program, it will be a lot easier for you to find externship sites and find jobs in future. So this is the first program that we're going to cover, which is a lot shorter. So this is a 3 months long program, 12 weeks. Remember, this duration is estimated. It's CPT, Certified Phlebotomy Technician by NHA. And the fee for it is upfront $2,000. And if you pay on monthly basis on installments, the pricing starts from $141. Eligibility is the same, offerings are the same, and there are 6 restricted states where this program is not available. If you complete this certification and you are in one of these states, you will find it very, very difficult to find jobs in these states. I mean, you can work in another state if you want, but we do not recommend. Medical coding program. So this is a 14 weeks long program. It's CPCA by AAPC. The price is the same as medical assistant, surge tech, sterile processing technician, dental assistant, pharmacy technician. So $3,450 start, and the installment options are starting from $266. Eligibility is the same, offering is the same, and there are no restricted states. Medical coding program I want you all to remember is an advanced level certification. So it's not an entry level certification, although there are no eligibility requirements which restrict you from registering for this program and getting certified. But it is a lot easier for you to pass the certification if you have some background in medical billing, and you can become medical billing specialist first. And that's why we have a program which is medical billing and coding specialist, which is CBCS by NHA. And this program has lower barrier of entry, so you can do the certification. This is 12 weeks, so it is shorter than medical coding. You get to learn introduction to coding in this program as well, and then you pass the certification exam, and you don't have any restricted states, which means that you can work anywhere as a medical billing specialist. And then you get the medical coding certification, and that's the growth trajectory that most of the people in this industry follow. So they become medical coders, they become medical billers, and then they become medical coders, and so on and so forth. They do the advanced level certifications. So we have 4 more programs to go. The next program is Healthcare IT, which is Healthcare Information Technology. And this program is very, very interesting because it offers 2 different certifications: IDF Plus, IT Fundamental Plus by CompTIA, and Certified Electronic Health Record Specialist by NHA. Now, this program is designed to help you learn the basics of IT and learn the basics of electronic health record systems, which are used all across the healthcare industry. And it also gives you a lot more information about project management, about data science and data analytics, how to really use the data, and a lot of other things, which sets a very, very good base for anybody who wants to join the healthcare IT field. So it does not only prepare you for these 2 certifications, it gives you a lot more knowledge, and helps you really kickstart your career in the healthcare IT industry. So the program is 16 weeks. It is 2 certifications, and because it's 2 certifications and we cover the cost of the certifications in this price, the cost is a bit higher. It is $3,950 for this program, and the monthly installment options start from $322. There are only 4 states where this program is not available, and this restriction is for CEHRS certification, not for ITF Plus. So if you are in one of these states, you can still enroll in the program, but the CEHRS certification is not really widely accepted in these states, so please bear that in mind. Again, you can download the syllabus from the website. So we also have a separate program, which is just Medical Health Record Specialist, CEHRS, by NHA. It's the same certification that we have in healthcare IT, but this is 12 weeks, and the upfront payment is $2,000, and the monthly payment options start from $141. The eligibility is the same, offerings are the same, and the restricted states are also the same as healthcare IT, as I just explained. The next program is EKG technician, which is, sorry, this is not EKG, this is CET by NHA. That is EKG, sorry, certified EKG technician by NHA. So that's CET. The name of the certification is CET by NHA. The tuition is $2,000. The monthly installment options start from $141. Eligibility criteria is the same, offerings are the same, and there are no restricted states. And you can download the syllabus from the website. All right, that takes me to my last program that I'm going to cover today, and that's healthcare leadership. Healthcare leadership program is basically designed for anyone who has completed their certification in one of the other programs, or they want to learn the basics of leadership while they do another certification, or somebody who just wants to learn the basics of leadership, and because they're already working in the healthcare industry and they are thinking about becoming a team manager, or even if they are thinking about becoming a better team player, this program is designed for them, and this offers a HTA certification. And the program is 12 weeks long. The upfront fee is 3,900 and $50, and the monthly installment options start from $322. Eligibility criteria remains the same. There are no restricted states, of course, because it's our own certification, and offerings remain the same as well. You can download the syllabus for this one as well. I have already covered pharmacy technician professional, so I will leave that and I will move on to our next part, which is admission process. So the admission process is pretty straightforward. You have to schedule the call with an admission advisor. You discuss the bootcamp details. You pay the tuition fee, complete your enrollment into your preferred bootcamp. Now, in order to schedule the call with an admission advisor, I'll show a QR code at the end of this webinar, or you can go onto the website, fill the form, and the admission advisor will give you a call straight away. Okay, and financing options. Perfect. So we have quite a lot of financing options starting from upfront payment. If you pay upfront for our programs, you get a very heavy discounts. So you can consider that. Or you can go with the monthly installments, which are available through financing partners, which depends on your credit check. But we have Meritize, Edley, Selime, and a few other options that are available. We also have Study Now, Pay Later options, where we have partnered with a firm where you can study now and pay later. You can talk to the admissions team about the eligibility criteria for a firm. We also have some of the MICA funding available as well, which is for people who are eligible for military funding for the cost of our programs. And we also have Workforce Innovation Opportunity Act funding available for those who meet the criteria for it. And the criteria is written right here. You are 18 years or older, you have GED or high school diploma or equivalent qualification, and you are unemployed or underemployed, and you receive food or cash assistance from the state. So these are the requirements, and if you meet those requirements, please feel free to reach out to Carla Coleman on this email or on this contact number, and she'll be able to assist you further for these details. And I'm just going to wait for 10 seconds for anybody who thinks that they are eligible for VOA funding. They can take a screenshot or note down the details. And in case you miss out on this information, go on to our website, scroll down at the end of the page, you will see admissions contact number, sport contact number, and you will also see workforce contact number. Call on the workforce contact number and Carla would be able to assist you through that. It's the same number that is listed here. HTA Career Services. Now, we try to help our students in every possible way to get them to the finish line. But remember that we will not claim nor promise to hand you the fish. We will help you learn all the tools and give you all the knowledge, and show you all the process and give you the roadmap to catch your first fish, and which means you land your first job in the healthcare industry. And we will help you with the network of peers and alumni, and our team will be there to support you in every possible way. But remember that you have to do the work yourself. We will only be giving you directions and guidance in every possible way. We do not guarantee anything when it comes to career services, but we do guarantee all the support from our team, the career services sessions, which will be able to help you with your job hunt process or externship process. So we have one-on-one career advising sessions where our career advisor will have a couple of career advising sessions with you. These are going to be one-on-one. They're going to help you with your resume, with your LinkedIn profile, all of the things that you can read here, your cover letters, and even some assets, communication assets to reach out to the employers and how to really approach them, what kind of email you should be writing them, what kind of discussion you can have with them on the call, what kind of questions you can ask. all of those things. They will guide you about it. And we also have a career prep course that I mentioned to you guys at the end of every program, which helps you learn some of the soft and hard skills that can help you become a well-rounded professional. So these are like time management, project management, how to deal with the manager, what kind of environment that you can anticipate to have in your team, and how to become a better team player. And a lot of those things are covered in that career prep course. And then at the end, if you ever have a job interview or you have a discussion with the employer, our career services team will be there to assist you with that. Okay, so I have a question here, which I will answer in a bit because we are at the end of our program. So you guys can go on our Trustpilot link, go to Trustpilot, write Health Tech Academy. You'll be able to see quite a lot of reviews over there. We just hit our mark of 100 reviews by our students, which is pretty big for us. And you guys can read about some of our students and what they say about HTA. And now I'm going to show you guys a small video from one of our students who got hired or she completed her externship requirements through HTA, and she talks about her experience. She was a dental assistant student, and I would leave you guys with her for the next couple of minutes.
My name is Kaylee Fender. I live in Indiana and I have future aspirations of being a dentist one day. So I really wanted to start at the foundation of dentistry as a dental assistant and sort of become more well-rounded and gain some more experience in the field before I follow my dreams one day as a dentist. So I really needed to find a program that worked really well with my schedule. I was a full-time student at university, and then once I graduated, I've been a full-time employee Monday through Friday all day. So it was really hard for me to get into an in-person program. So I have found that Health Tech Academy was really great, especially with it being all online and at my own pace. I could manage my full-time schedule as well as this program. And I really enjoyed the course material. I found that it aligned with a lot of other classes that I've taken involving dental assisting and dentistry itself. And so it was really nice to brush up on all of these topics. And I really liked how each module had its own quiz as well as its own exam. So I felt like I could go ahead and knock out the quizzes and then come back for review and do the exams and make sure that I'm hitting all those important points with the material. I also really liked the helpfulness of the team. I was constantly meeting with my advisor, and she was always on time. She always had sort of a schedule laid out for us, like this is what we'll cover this meeting. By next meeting, you should be doing this. So I felt like I was really on track, and I feel like I did kind of go through the program quicker than many students would, but I felt that the team was really good about keeping up with my pace, and so I really appreciated that.
I think, we don't have a lot of time, but you guys can hear from Kaylee Finder on YouTube. And you can also read all the testimonials that are there on the website and on Trustpilot. So now I think we will start our question answer session. I will get back to you guys for the questions that you guys have you have asked. And here are some of the QR codes which you guys can use. So visit HTA website, talk to admissions team, and if you are confused which program you should be choosing, we have a career assessment for you where you can uh, see what we recommend you based on your career interest. So there was one question that I'm going to answer first. So if you need more information and you want to talk about somebody, you want to talk to someone about your interest and the program that you should be enrolling, so you can schedule a call with the admissions team. There would be an admission advisor assigned to you, and they will be in touch with you throughout the process while you choose a program. Now I will get back to the questions. Maria has asked a question. Can you repeat what is the difference between sterilization program and surgical technician? Okay, so sterile processing technician is basically somebody who makes sure that all the surgical instruments are sterilized. They line them up the way it is supposed to be lined up, and they make sure that the sterilization process is followed before a surgery, during the surgery if required, and after the surgery as well. And that's all what their role is. A surgical technologist, on the other hand, is somebody who has to hand over the surgical instruments to the surgeons, and they have to assist in the surgery wherever it is required. So they are much closer to the patients. So they have to deal with the patients directly, while sterilization, the sterile processing technician remains in the back end, and they don't really interact with the patients directly. In terms of the program, the difference is that our surgical technology program, I mean, the program is different because the content is a bit different. The concepts of sterilization is different, and the concept of surgical technology is different because there you understand all of those surgeries and their details. In terms of the job opportunities or in terms of the certification, you have to complete certain number of hours for both of those programs, but those requirements are a little difficult to be completed for surgical technologists as compared to sterile processing technician. And the reason is because surgical technologist program is a lot more critical, and those roles are a lot more critical. And that's the reason why the clinics and institutes and hospitals always prefer somebody with some kind of healthcare experience, because they are more likely to follow the guidelines easier, because it's a very critical role. There is little to no room for any errors. So the margin of error is very, very low. And that's the reason why they go with somebody. They prefer those who have some experience. And that's because the market is saturated. There are a lot of people who are waiting for the jobs. And that's why it gets a bit difficult, because you have to kind of compete with them, and they choose those, or they select those who have some kind of healthcare background. Although in order to be certified, you don't really need to have any experience. But because of this kind of trend in the industry, we do recommend the students to get some kind of healthcare experience. And sterile processing technician program can be a great way to do that, because it's easier to find externship programs there as compared to surgical technology programs. So I hope I have answered your question. SC Collins said that I have a question. I think you asked it in the chat. Let me go to the chat box and answer. SC Collins is saying, is anyone talking to us? Yes, I am. I think you cannot hear me. Can somebody from my team please let her know in the chat box, so she knows that there is something wrong on her end. Okay, so I have repeated the difference between these two programs. Tania is asking, sterile program is step before search tech if you have no healthcare experience. Yes, that's correct. That's a good way to put it in short words. So do I need previous experience to enroll? I have phlebotomy and EKG, but I don't have work. I have phlebotomy and EKG. Are you saying you have phlebotomy and EKG certifications? Or you have work experience, but I don't have working experience. Can that be useful to start the surgical technician program? Maria, the short answer is yes. I mean, you do need, if you have the experience in the industry, that will give you a lot of advantage, and it will be a lot more easier to find the externship and to find the job sites. But if you have EKG technician certification and phlebotomy technician certifications, uh, you will definitely have advantage over those who does not have any experience at all. But you probably won't have enough advantage as compared to those who have direct healthcare experience, if that makes sense. So that is there. And yeah, I'm sorry, Jasmine, I think I missed your comment on top, and I just went up to see that you want more information on EKG technician. I think I missed this, that EKG technician also has a little bit of clinical components. You can complete our program, and then there is a clinical component that you have to complete, and then you can appear for the certification exam, because completing those clinical hours are important. In terms of more information, the best way would be to go onto our website, and you can find the EKG technician website page. That's the first step. The second step is that you can reach out to our admission advisors, fill the online form. One of them will reach out to you and answer any of your questions. And last but not the least, if you still have any of the questions, you can message somebody on in our team, and you can find the contact details on the website, and they'll be able to assist you as well. So there are a lot of ways to reach out to the team. And the other way is to directly schedule a call with the admissions team, and they'll be able to assist you. They'll send you a one pager which will have all the information about the EKG technician program. Okay, SC Solins, Collins, sorry, you can now hear me, so I'm going to respond to your question. I have an associate's in medical assistant with no experience. So if you are thinking to enroll in Surge Tech, I've said this to another student, that if you have direct healthcare experience, that is going to give you clear cut advantage in terms of finding the externship sites, in terms of completing the requirements, in terms of finding the job sites for surgical technology program. But if you do not have a healthcare experience, direct healthcare experience, even though you have associates in medical assistant, that is not going to give you a very big advantage. But remember that because you have associates in medical assistants, you will definitely have advantage over those who have no experience. So you are halfway there, not at the ideal place, but you are halfway there. And if surgical technology is the only program that you want to enroll, I mean, we won't stop you to enroll into a program because you have some kind of academic background, at least in medical field. But yeah, that's what we would say. It's not a, it is in the gray area. It's not a clear yes or no. And I hope you can understand why that is the case. Um, I like how people are connecting with everybody. That is great. You guys should definitely get in touch and stay in touch, and study together. If you decide to enroll in one of our programs, sorry, I'm confused. I have my phlebotomy certificate and EKG, but I don't have working experience. Can I still be in the surgery program? Do I need working experience before I can study the surgery program, technician program? I know this is confusing, Maria, and I'm sorry for making it more confusing for you. Let me put it in short, summarized manner. Yes, you can enroll into the program, but that is not the ideal case scenario. Ideal case scenario is where you have direct healthcare experience, and it will make your process a lot more easier in terms of finding the job, in terms of completing the externship hours. So that's the ideal case scenario. The Not the worst, but I don't know the right word to use, but the worst case scenario is that you don't have healthcare experience at all. You are in the middle where you have some experience, which is academic experience. And this is the same as what I was saying to SC Collins, that she has associates in medical assistant, and you have certifications in phlebotomy and EKG, but at the end of the day, you don't have direct experience in the healthcare industry. However, one thing which I think probably take you one step closer to having medical experiences, that you can get a little bit of experience in EKG technician. So while you start our program, you can start finding a job in EKG or phlebotomy, or find an externship. Anything that gives you a little bit more hours will help you towards your externship hours. Because you have already have certifications, you enroll in our surgical technology program, and while you complete the learnings for the program, you can do some externship, gain some experience, and that will help you with externship hunt and also the job hunt. I think that would be the best approach to take. But you can definitely enroll in the program. I would recommend that. Okay. The dental assistant program is being offered in some schools, but there are fees. Some request student to go in person, which is very confusing. Yeah, there are. So every school will have a different fee because that depends on their offerings. Um, you can you can consider our program, go over the website, see the details that we have for our program, and then make your decision. Um, I saw on Facebook that this was free, so we have to pay. So SC Collins, this webinar is free. You don't have to pay for it. And I hope that nobody has charged you anything to join this 1 hour webinar. So this information session is absolutely free. Talking to our admission advisors is absolutely free. Taking their recommendations is absolutely free. But in order to enroll in one of our programs, that would of course cost money. And I've just shared the details about the fee that we have. I hope that makes sense to you. I think I've covered all of the questions. But if there is anything that I've missed, because I see a lot of people talking to each other, which is great. I love that. But in case I've missed anything in between that, um, I'm sorry for that. That's fine, SC. That's fine. You will receive a recording from us. If you don't receive it, go to our YouTube channel and you'll be able to see the recording in next couple of days. It will be uploaded, or maybe on Monday, because today is Friday. So on Monday you'll be able to see the recording for this session and you can go over it. And I think that is it. I loved how you guys asked the questions, and I just loved how you guys connected to each other. That is perfect. If you guys need any assistance, any help, feel free to reach out to our team using the contact details which are here. And if you don't get the help that you are looking for and you want to speak to me directly, feel free to email me at danish.khan. You can read the spelling for my name right here on the screen. So Danish.Khan @ healthacademy.org, which is our website. So feel free to email me if you have any questions and you think I should be answering those. And I'll be more than happy to assist you guys afterwards. I think this is it from the session. I don't see any more questions in the chat. Thank you so much, everyone, for joining in. And I'll give 10 seconds for people to just get in touch with Dania. She just shared her details. So I'll just wait for you guys to take those details. But that's it from our side. Thank you so much, everyone, for joining in. I hope to see some of you guys on this side of the table where you enroll in one of our programs. And even after you enroll, I'll be there to assist you in every way possible. And so will be all of our team here at HTA. Thank you so much and best of luck for decisions that you will be making around your programs that you're going to enroll in. Thank you so much. Take care. Bye bye.